Hello everyone and welcome back. In our previous video, we have gone through the history, transmission and pathophysiology of coronavirus. In this video, we will jump into diagnosis and treatment and will have a bird eye view on the facts of these treatments. Diagnosis is due for the person with symptoms like fever, cough and shortness of breath. Sometimes GIT distress is also present. There are a few symptoms of disturbances in taste, but for sure, person with temperature, cough and shortness of breath should have his diagnosis. The family members of the patient should also look forward to the diagnosis because they are prone to this disease and may be sometimes asymptomatic also. Sometimes person with strong immune system may also give rise to severe symptoms. This is known as immune storm. During this condition, person's immune system is overactivated. The excess of cytokines are produced and these cytokines may fuel up the death of the patient. In most of the cases, this condition is observed in strong persons like athletes. Keeping all these aside, the diagnosis should be done by polymerase chain reaction known as real-time PCR. The lab doctor or attendant will have a nasal swab and then in couple of days you will get result. Next one is antibody test. Antibodies are Y-shaped structures which are produced as defensive soldiers of our immune system. The initial and the first most important antibody is IgM. Its presence can be checked in the blood in a few days. However, all these tests have their sensitivity ranges, so you may get sometimes false result. Next, you can have complete blood count CBC, liver function test LFT, and renal function test. Leukopenia is usually present in severely ill patient. ALT and AST levels will also increase due to damage in liver if present, and blood urea nitrogen burn and creatinine will increase in case of severe problems to the kidney. Moreover, chest X-ray can be performed to have a look on the condition of the lungs. Covid-19 is a novel coronavirus and we are still fighting to find out the way to kill or to control this virus. Therefore, different trials are being performed on a variety of medicines. Some herbalists believe that Senna Makki can treat the disease. Senna Makki has botanical name Cassia angustifolia. It contains a variety of chemicals, and due to these chemical constituents, it is known for its laxative effect. Means the tea prepared with this will help you relieving constipation. There are a few studies there also showing the anti-inflammatory properties which can be helpful to relieve the symptoms due to immune system hyperactivation. However, no antiviral study is available for this plant yet. Vitamins are naturally present in different fruits. They are helpful in performing different metabolic activities in the body. Vitamin C and vitamin E along with others have antioxidant properties and boost up the immune system. This should be added in the food either from natural sources or from artificial sources in the form of tablets or supplements. The main goal is to achieve the recommended daily allowance of these vitamins to help boost the immune system. Remdesivir is antiviral drug. This drug controls the synthesis of RNA by incorporating its metabolite in the RNA sequence. This inoculation results in the false production of required viral RNA. Thus, final copies of viruses are not produced or faulty copies, I must say, may be produced. However, the genetic material of coronavirus family is continuously showing mutation, as we have seen in last video, in the form of SARS, MERS and then Covid-19. We have already made one video on this topic for your interest. If you are interested, and current information is also showing some problems in current clinical trial phase of this drug. Therefore, we need to have some other drug. There is a well-known mechanism of chloroquine to change the pH. Yes, next drug is chloroquine. This change in pH may be responsible for the decreased replication of viral copies or even can play a hurdle in the synthesis of new copies. However, there is question mark on the effectiveness of this drug and no proper study and clinical trials are there. Or at least risk-benefit ratio is very high, so health professionals are looking at different options. Next is azithromycin. Azithromycin is antibacterial drug and controls the synthesis of protein. There were a few rumors about the effectiveness of this drug for the treatment of COVID-19, and now different clinical trials have shown that there is no effectiveness of this drug for the treatment of COVID-19. Tocilizumab is next in the list. It is monoclonal antibody. It inhibits the binding of interleukin-6 with its receptor. This binding initiates the hyperactivity of immune response due to B cell and T cells. This antibody may decrease the severity in the symptoms of COVID-19 patient but does not have antiviral activity. Therefore, running in search of this drug is also useless unless patient has hyperactive immune response and we need to decrease his symptoms. Next one is Dexamethasone. It is becoming another drug of choice during this pandemic. Really? No, not at all. This drug belongs to the class of drugs known as corticosteroids. This drug again decreases the immune response and may give some relaxation to the patient by decreasing the symptoms. So guys, keep in mind that this drug is not antiviral drug and will not treat coronavirus. What it will do? It will just decrease the intensity of the symptoms. If some person is already weak and his immune system is even unable to fight, this drug can further decrease his immunity and then the results will be unacceptable. So please don't believe in any rumor, don't be panic, don't spread false information. Someone may actually believe in your words and then can face severe consequences. Hope so you enjoyed the video. What you think about these treatments, write in comments. Keep good care of yourself and your family. Don't be panic, stay relaxed and keep social distancing. Bye bye.